Good afternoon, everyone. My name is Leanne Larson. I'm the Vice President of Education and Marketing with the Wisconsin Hospital Association. And I'd like to welcome all of you to our webinar today, Healthcare Revenue Cycle Management, an examination of self-service versus full-service patient billing. Today's webinar is being presented by WHA valued corporate member, Meduit. It's now my pleasure to introduce you to our speakers. Jeff Neiman leads Meduit's top-notch team of healthcare revenue cycle professionals to maximize performance and accelerate growth for hospitals, health systems, and provider groups. Prior to joining the Meduit team, he was the Chief Operating Officer for Navigant Symmetrics, a revenue cycle management company serving over 200 hospitals. He has also held leadership positions at Conifer Health Solutions, Humana, and HCA. He has a BA in economics from Bellarmine University in Louisville, Kentucky, where he graduated magna cum laude. Greg Rossier joined Meduit in 2019 and is responsible for overseeing the company's day-to-day operation. Greg brings with him a wealth of experience as a revenue cycle strategist, executive, and consultant, where he focuses in the design, implementation, and transformation of the healthcare revenue cycle and call center solutions. He is an expert in creating process efficiency and partnering with customers to provide industry-leading revenue cycle solutions. He has over 25 years of experience in operations, process management, technology-driven automation, mergers and acquisitions, organizational assessment, and consulting. In addition to his recent work as a strategic transformation consultant, he has held executive leadership roles with Convergent Inc. and Conifer Health Solutions. He has a BA in economics from Washington State University. And with that, I'll turn things over to Jeff.
Thanks, Leanne. Appreciate the introduction. I thought just for those of you who aren't familiar with Meduit, we'd start with kind of a quick introduction to the organization so you can get a sense of who we are, and then we'll dive into the content that we're here to present today. So Meduit, we are per Modern Healthcare, the number one largest revenue cycle management company in the U.S. based on number of customers. Here you just see a map of the U.S. with representative push pins of where our customers are located today. We also have about a dozen offices around the country, spanning every time zone. You see those listed on the right-hand side there, and the states that we're in with those offices are shaded orange on the map. Few statistics here on the company. Our customer base today consists of over 1,000 hospitals and large physician practices. We've got about 150,000 physicians supported by our various services. We have 1,700 employees across those dozen locations that I mentioned earlier, although in this day and age, we're about 60% work from home and 40% office-based. We are focused exclusively on healthcare revenue cycle management. There's, nothing outside of healthcare that we're doing today as an organization. And to give you another sense of the size and scale, we managed about $56 billion in AR in 2022. So from a total AR perspective, we're kind of on par with some of the largest health systems in the United States. I'll say what's different about Meduit is that we don't have a big anchor customer like a lot of the other large revenue cycle management firms. Although we do business with a lot of premier healthcare organizations around the United States, names that you would certainly recognize, no one customer makes up more than 5% of our revenue. So we have had to be, very flexible in our solutions, very focused on delivering services to the patients in each individual market, or that each individual provider who's a customer of our services. And as a result of that, we really focus on delivering outstanding service and really partnering with our customers. So we're very proud of what you see there a net promoter score of 68, although 68 would be a pretty poor grade in school. I would be upset if one of my daughters brought home a 68. If you're not familiar with net promoter, those actually range from a negative 100 to a positive 100. So a score of 68 is on par with organizations like Ritz-Carlton, BMW, Apple Computers, premier brand names that people really want to align with. All right, our solutions across the revenue cycle. Again, this arch is just kind of a depiction of revenue cycle from scheduling here on the left side all the way through, patient collections, post-bill drop activities on the right side of the arch. The little offshoots and boxes are just the different solutions that we provide. But again, to give you a sense, we do all things kind of post-bill drop, so collections and follow-up from both insurance companies and patients, and then have been over the last few years working our way upstream with different solutions in the front end around scheduling and pre-registration, and starting to build solutions in the middle like coding and things as well. All right, so just a quick view of who is Meadowood, if you will, and now we'll jump into more, obviously, the core content of what we're here to talk about today around patient engagement and how the right ways versus the wrong ways are to engage with patients. I'll say generally, we've seen a huge increase over the last 2 to 3 years in companies that are pushing self-service very heavily. And, we're not here to say don't do self-service, but we're here to say, really make sure you're doing it the right way. And self-service is not a be-all, end-all solution, despite what some of these startup companies would tell you that you may run into. So with that, I'll turn it over to Greg to kind of outline the plethora of potential communication solutions that are out there.
Thanks, Jeff. Yeah, so I think that's exactly the conversation we're trying to have today, is talk about self-service and full-service solutions and how you find the right mix between what has historically been used, what are some of the newer solutions that are more significantly across the industry today and growing, and even how do we stretch that to what's coming next, what are going to be the next impactful focuses. So if you think of the traditional paper statements, paper checks coming in the mail from a result of those, phone calls going out, phone calls coming in, you would expect, those have naturally started to gravitate to interactive voice response systems to start that self-service process for individuals via phone. Those natural growth into now the web portals that will allow the patients to self-service, identify more information about their accounts. And now, thinking about how do you develop patient financing and payment plan management, and how do you start to engage patients, which will be a common theme as we talk through that, whether it's, the typical phone calls and letters to now more digital solutions. Are you able to chat? Are you able to text? Are you whether to email patients? And now what's coming next in the full service stream of solutions, whether it be something along the lines as AI-based solutions instead of your traditional interactive voice response, or even stretching past that as you think about apps that generate value for patients.
All right, so I think we're going to start with just kind of describing one of the more complex and high-end solutions that we've seen in use out in the marketplace. I will say, as you hear this, probably 1% to 2% of the organizations that we talk to have implemented a solution like this. And the solution very simply is some sort of a web app to drive communication and interaction with your patients. So whether that's a hospital branded app or something else that's on their phone, right? There are kind of off the shelf apps you can purchase. We have one, you see it on the bottom here, called the Patient Concierge app. It's got an avatar that walks out and talks to patients and explains their bill to them. They can scan their bill by taking a photo of it and then point to various areas on the bill. And in our case, right, Eve explains the bill to you as you point to it. But with that app, you can do all kinds of things, right? Patients can link into the call center with the push of a button. They can use a chat or a text functionality within the app. And even probably more big brother-ish, you can track patients if they choose to allow you to track track them in the app and use things like geofencing. So if you're not familiar with that, geofencing is you're literally just drawing an imaginary boundary or outline around your facility or the property that your facility is located on, and based on a patient crossing into or out of that geofencing, you can target select messages to a patient. So where we see that with the most sophisticated customers we work with is a patient comes onto the property of the facility and they get a welcome message. Perhaps sometimes that's just a text style message. Sometimes it's a actual video, maybe from somebody in the facility welcoming them. Or you can set up both, where a person can click on a link to the video, or they can just look at the text message. But typically you're welcoming them. Sometimes maybe you're linking them into directions on how to get to the specific area or which parking area to use on the grounds of the campus, those kind of things. Conversely, when somebody crosses the geofence leaving the facility, you can send them a thank you message, or you can send them a link to an immediate survey so that you're not waiting weeks for an HCAHPS response that they may answer differently 2 weeks later than what they answer right on the spot right after they got the service. So all kinds of pretty cool, sophisticated uses for this. Again, I think this is going to become more and more common as time goes on. The adoption rates will start to pick up, but today we're in the early phases of this, and I would say like adoption rates have gone from maybe 1% 2 years ago to 2% last year, and maybe they'll double again up to 4% in 2023. But kind of as you see new technology get adopted and roll out, it kind of has that doubling effect, Moore's law, so to speak, almost the opposite, the inverse of that, but a doubling effect of adoption. So I do think this is going to become bigger, but today it's still a relatively small utilization of ways to engage patients. All right, so as I kind of said today, the rest of this we're going to cover just what are the different self-service solutions that are out there. We started with that complex one. Again, it's not common. We're going to start to get into here much more common methods of communicating with patients. We'll talk a little bit about self-service and what works and what doesn't, right? There's limitations. Again, we've seen this kind of build it and they will come mentality with self-service, that it's going to be the be all end all of the future. And maybe like 20 or 30 years from now, it will be, but we want to caution you, it's not there today. And we'll, again, share some very specific statistics around that and experiences that we've seen. We'll share with you just our recommendation. If you haven't figured it out already, we are very much in the angle of full patient service is what you want. People have all kinds of different preferences on how they communicate or prefer to communicate, and the best way to engage your patients is to offer the full suite of capabilities, not force them into a self-service solution that they may or may not want to use. And then I think we've got, just a handful, like 2 or 3 real world case studies in here that we'll go through with you as well, that kind of are anecdotal information of what works and what doesn't, and some specific kind of returns and numbers on that.
Yeah, and to that point, right, we are huge proponents of self-service tools, but I think that the point about this being the best combination of things, and how you manage that. And we'll be talking a little bit more about the facts and fiction along with those. So let's talk a little bit about facts and fiction. So none of these should come to any surprise, I would assume, to most of the folks that are on this conversation today. But obviously there's increased pressure that's getting put onto patients as their portion of the medical fees has grown so significantly over the last 20 years, from 5% to over 35% today. As you think about the reasons why, we all know high deductible health plans have been, ever increasing as part of that. You've got this shifting from employer plans to the employee-based responsibilities, less insurance coverage for the same or more money, and then just that natural rising cost of care that you can count on 2.5% every single year, transitioning directly to the patient. So you've got that additional burden. There's no stop in sight to that particular pressure. And then as a result, obviously those patients are going to struggle to be able to pay for that care. See providers, and there's a wide swath of what providers are recovering based on hospital versus physician or specialty, based on the demographics of your patients and services and such. But they're only collecting somewhere between 20 and 55% of what the patient owes in the self-pay process. And obviously those collection fees can be expensive depending upon what you're doing. Statements, right? How many paper statement costs are going up every 6 months from the United States Postal Service, just increasing postage fees and material expenses, as well as just the cost of staffing and the support methodologies and telephony to balance those things. So there's obviously huge pressures on the expense side of things. And then, so as you look at self-service solutions, three of the more common examples, having that interactive voice response, the phone portal, if you would. Patient can call in and self-service, pay their bill, get information, whatever it might be, directly off of the phone. That's self-service driven online with the web portal, usually connecting that with a capacity directly from your phone to connect, whether it's to the app, to the email, via the texting, whatever it might be, and obviously all the online capacity. So self-service collection solutions, right? Convenient for the patient, most patients, depending upon how they want to deal with their engagement to their provider, a lower cost solution for a provider. So there's definitely wonderful opportunities within a self-service solution. The issue that we have seen, I think, on the fact versus fiction is potential vendors advertising that 89% of the time patients are able to resolve their claim with pure self-service. And what we see is there's maybe some slight differences when you start to peel away some of those layers. We have a very large organization with a significant client base, so we've got a high level of data to analyze. And what we're seeing is that, that success rate is usually in the 40 to 50% range. So a couple factors to that. As you think about, self-service solutions, you still have a pretty strong basis of your patients that want to pick up the phone and call someone. And there's multiple reasons to that. It's their natural methodology of how they want to communicate. They don't understand their bill. They don't understand why insurance did or didn't cover it. They don't understand what their payment options are, how to resolve those solutions. And so typically we're seeing almost 50% of patients prefer to speak to someone to be able to deal with that. And they feel like they need to speak with another human to understand those complex issues with resolving their claim. Complexities of healthcare billing and just a general individual being able to understand their EOB, for example, and the billing perspective, understanding how the entire billing process is working. So if 50% of the people typically want to pick up the phone, the other 50% of the people are usually going to start in with self-service to work through their issue.
I go off mute to talk. Unfortunately, there's bad news on that side of the fence a bit as well, though. So while only 50% are going to try to use your self-service technology, our statistics from multiple client studies are that only 60% of the patients who try to use self-service technology actually complete the transaction, meaning going from pulling up the account in the system all the way through paying the account and completing the work you wanted them to do in the system. So the reality is, based on our studies, only about 20% of your entire patient base is going to be able to successfully use your self-service technology to get the outcome you wanted them to use. Again, doesn't mean you shouldn't use self-service. That's great. There's 20% of folks that you've now skimmed off, that you don't have to send letters to, that you don't have to do phone calls with, and so forth. But again, 80% of your patients are either going to not want to use this at all and want to engage in a different way, or are going to try to use it, run into trouble. Again, it's kind of astounding, unfortunately, more than 60% of people run into some kind of trouble. And the trouble could just be that the information on your web portal doesn't line up with the EOB that they got from their insurance company, or they just don't understand why they're being asked to pay the amount that you're asking them to pay, right? So it could be as simple as that. But if you don't have another way for them to contact you, whether it's email, chat, telephone, whatever, if you're just saying, here's the portal, pay, or there's no other way to resolve your issue, you're really going to turn a lot of patients off. And again, unfortunately, we've seen some people taking that tact where we're going to underman our call center or even shut it down because we now have this self-service solution. And if they need to talk to somebody, they can talk to somebody when the account goes to bad debt, right? Not the best way to engage your patients. So from all this, what's the bottom line? We've seen really, in the studies we've done, zero lift to performance or collections from reliance on self-service solutions. So again, I'm not saying you can't save some money by deploying these solutions and reducing phone calls into your call center and things like that, but it's not going to be overwhelming. We've heard these stories like, okay, stand this solution up. There was a multi-hospital health system out in the West Coast that we work with that brought in one of these self-pay solutions and bought the pitch that 75 to 80% of their people were going to self-serve, and their reliance on call center solutions were going to drop to almost nothing in a very short period of time. What we found out is the exact opposite. They deployed this solution, they marketed the heck out of it, told every patient to go online to pay their bills. They took out billboards about their new patient portal, just all kinds of stuff. The reality is our calls have gone up. We handle their calls for them. The calls have gone up since then, not down, because again, patients are not understanding the text that they're getting. They're not understanding when they go out and look what they're supposed to pay, how to properly set up a payment plan, all those kind of things just generate questions that we have to deal with. So, we've seen all these like pitches that, within 30 days of implementing this solution, you're going to get a, 50% lift in patient cash or, things like that. We have yet to see that. And I'll share a couple case studies here in a few minutes. All right, our first case study here, again, this was a self-service organization that came into a multiple hospital health system, very large regional player, and after 1 year of service, published this great case study, posted the results on their website, patted themselves on the back on what a great job they had done, and their claim was that they had increased patient cash by 13% within 1 year of deployment of self-pay or of self-service solutions, right? So seems pretty reasonable. Okay, 13%, I can buy that. The reality is, again, this is somebody we were engaged with and we had access to all the data. So we did our own analysis to try to say, is this true or is it not true? The very simple and unfortunate reality of this case study is that the health system had purchased an additional hospital over the course of that year, and their patient volumes were up 13% as a result of the expansion through that acquisition of a facility. So the reality is, just through the course of their volume growth, you would have expected patient cash to be up 13%. Our conclusion from that, obviously, is that we were seeing a net zero impact from the deployment of the self-service technology. All right, second case study, and this is kind of on the opposite extreme. So this is a organization, again, a 5 or 6 hospital regional health system in the Midwest. They were doing just the traditional send a letter and answer an inbound phone call if somebody calls you. They were doing no outbound calls, no outbound text. They weren't using text at all. They had a bill payment portal, but they didn't even advertise it in their letters. It was something you just had to naturally log on to their website to find and so forth. We came in, revamped that entire process, set up a dynamic payment portal, started to have an ability to link into the payment portal, even via QR code on statements, things of that nature, texting with links into the portal, really a full kind of comprehensive patient communication plan, as we had discussed earlier, going from just that simple billing and answer the phone if they call you to a more interactive experience for patients, if you will, and an aggressive outreach, meaning if a patient wasn't paying, we were texting and calling and reminding them and asking them to pay. This 5-hospital system got a increase in collections of about $500,000 a month. So again, $6 million a year that they saw in additional cash flow from those efforts. Now, I will disclose, we didn't have access to their bad debt data or performance. So I can't really tell you if that's a net new $6 million a year that increased their EBITDA, for example, or if it was just cash acceleration from bad debt into an early out pre-bad debt collection cycle. But even if it was the latter, right, we're going, let's say we reduced their cost 10% from going from a bad debt collection effort to an early out collection effort on $6 million. Just that alone saved $500,000 a year for the health system, not even taking into account any bad debt expense reduction and drop to EBITDA that they may have been able to experience as well. All right, and then the third and last case study that we've got here, this is a single, very large regional health system, 600-bed health center. They had contracted with us to do early out. We had been successfully doing kind of full service early out collections for them. They bought into this pitch from a self-service only company that came in and said, deploy self-service only for the first 90 days. Don't answer inbound calls from patients. Don't even give them the option. We're going to text them a link to the website, and the only payment option you're going to offer them for the first 90 days is this ability to link onto a self-service website and pay. And so then they were going to give us the accounts for 30 days after that, between 90 and 120 days, to make phone calls to the patient before the accounts went to bad debt. So the leadership team bought into that change, went all in with it. I think they lasted a whopping 6 months with that change before they came back to us and said, this just isn't working, right? Within the first year, what they found out was a huge decrease in total patient payments. They really wanted to go back to what they were doing before and deploying a full service solution. So, the website, the texting, they appreciated it, they wanted it, but they recognized very quickly that you have to pair that with outbound dialing, with, multiple ways of communicating with the patient. You have to have an inbound call center for patients to call. I think they didn't have the staff in their own business office to do it. And so their switchboard at the hospital got overwhelmed with questions, and they really had nowhere to route the questions to other than their insurance collectors. So they ended up even collecting less money in insurance because they were diverting, some of the work that those folks were doing to talking to patients and things. The whole thing kind of turned into a disaster that they backed out of pretty quickly. But again, purpose here is just to share these 3 case studies with you from multiple different angles to, again, show that, look, we think self-service is great. You should be doing it, but you should be doing it as part of a much more comprehensive patient engagement strategy and not buying into this myth that, you can deploy these solutions and cut all your costs from your call center out and stop offering traditional communication channels.
So again, just wanted to be clear, right? It's not all doom and gloom. We're not trying to say that self-service is not a valuable tool. I think the point of what we're trying to get across is the right mix between what we would consider traditional communication methods and self-service, and even kind of those next generation. It's all about mixing those together for the convenience of the digital communication for your patients, being able to self-serve if they want to, but still having that full service solution with an educated, compassionate, empathetic team that knows how to support your patient base so that they stay engaged, they get the right contact with the right patient at the right time, I think what we're trying to do is think about how do we spread, if there's been A to Z different methodologies, how do we keep moving from left to right to expand the patient communication concepts to drive more engagements, linking it back to the conversation that more and more of the responsibility of the balance owed is driving to patients. How do we get them more engaged in their responsibilities to help them resolve their claims? And obviously, we want to see more engagement. We want to see improved collections. We want to see it at a decreased cost against rising expenses. And so we're trying to figure out the right mixes always of balancing those things together. So as we consider self-service solutions, depending upon where you're at, do you have the standard business office that is sending statements and taking calls and making calls and using some of the basic solutions? Are you a little further along in your expansion? The question always is, how do you continue to stretch? What's the next best valuable component? One of those case studies in there, case study one, that same large health system has a significant 17, 20 plus hospitals in it, and they're using a separate vendor to provide text messages. And texting to a patient to drive collections seems logical, but they'll launch 5,000 texts out to patients, and we'll get 3,500 phone calls in to be able to try to resolve what that patient is looking to solve within that conversation. And the real basis of the issue there is your text is meant to be a self-service solution to fend them off from having to call somebody and talk through a situation. So the resolution should be having a text that links the patient back into your portal that gives them the solution to look at their bill, to look at their explanation of benefits, to look at their payment options, to be able to self-service, truly self-service. And so, for example, when we use a text to portal for our clients, we'll get 3 or 4% of patients that are going to opt out, maximum, usually in the 1% range. We'll get less than 20% of the people that actually need to pick up the phone and talk to someone, because you're getting them to the point where they can solve their problems themselves. So don't just text to try to collect money. You're texting to drive patient engagement to self-service. And it seems like it's relatively the same thing, but that example is a true life situation where they will send out 5,000 texts on a Monday morning, and our call centers will get flooded with phone calls shortly thereafter. That is not a good patient engagement model. So we want to try to drive those differences in the business. Obviously, everybody, I saw a high percentage of folks have web portals. Just continuing to try to drive the value and what that allows to self-service and negotiate through getting to payment in the right formats, driving patient financing where needed, those types of things. Obviously, the apps are starting to stretch. The voice AI is starting to stretch. But those apps that actually will help explain a bill to a patient will allow them the right access points of how do I go get X or Y or Z. Those things drive more value and will help drive engagement, but more so will help drive that patient culture of how do I go drive my own success here versus always relying on somebody on the other side of the phone to solve the problem for me. And so those are big components of things. And then obviously all the methodologies on trying to follow up. What's the right time, the right method to be able to contact that patient to help them solve the claim, whether it's the traditional solutions or more the self-service technologies. And then obviously, as we have been obviously huge advocates in the whole conversation, why we're talking through this, self-service is great, but we feel like you have to have this full service solution, which is combining self-service with that quality team of people. When they do get to a phone, they've got somebody who's got empathy-driven expertise on how to solve their problems. You've got the ability that if it's not over the phone, if it's via chat, same capacity, help them solve those solutions. The self-service link backs, don't just text them to drive them directly to a place where they can solve their problems. And obviously have that full-time access that if I can't understand how to solve my own issue, or I got questions past that point, that they can get a hold of a person real time. Additional considerations that I pass along as you're thinking about patient engagement and trying to change the culture, and more importantly, trying to capture what's going on with your community, is if you've got these full service solutions, have voice analytics technology that's going to record the calls, which is great for analyzing quality and things, but it's also able to then wrap around what did we hear from that patient? What does patient satisfaction look like? What are the trends of what they're saying about your statement process? What are their dissatisfiers? Being able to lump those things, benchmark the patient financial experience, and use that as a feedback loop, right? Capture the voice of your patient. What are they saying? And then routing that information back to the providers. Is there opportunities in the scheduling process, the registration, the point of service collections, whatever it might be? They need more information why they've got a denial claim. How do we get them live data on why they were denied, for example? So that it's turned to patient responsibility, or whatever it might be. All of those things, use the technology that's available. If you are doing this with your own business office, you're using an outside vendor, those are the types of considerations. Those are the things that you should be asking for, or defining how your group is going to deliver that information so that you can feed it back into the cycle. A feedback loop of information from your patients is vital to being successful. And with that, I think what we're really trying to hit home is self-service is important. Fact versus fiction. Self-service is not likely to solve all of your patients' needs. The full service solution is what we feel is going to hit the sweet spot of not only changing patients' engagement, improving that, but also changing the culture of how patients deal with things, while still helping to lower the costs by using some of those tools and technologies, and driving cash collections. And my takeaway from this is always, okay, what is the next big step forward? If I'm gonna, I can't go from, if I'm at A to L, I can't go from L to Z overnight. What is my next step? What is the next piece I'm going to add to drive this performance improvement? So that would be typically where I would drive people next.
We're happy to answer any questions if people have questions, Leanne.
All right, great. Jeff, Greg, thank you so much. Appreciate your expertise. I do have a couple questions that have come across. The first one is, if we need to prioritize our full service tools due to budget, what would you say are the most important ones to offer?
Greg, you want to take that one?
Yeah. So I assume I'm going to make a general assumption on two parts, that it looked like a majority of the folks we're talking to have patient portals, right? Those are key to self-service success. Again, assuming that they've got a significant call volume coming in, they've got a general interactive voice response system that allow, again, self-service for patients calling in. And so if I make those two general assumptions as being standard solutions across the board, if it didn't come across, texting, especially texting links to those portals for self-service, I would say those are the biggest impacts we've seen. 5 years ago, I would have said, email was going to help, reduce cost and being able to send statements out to patients electronically versus, the typical snail mail. But I think today, texting seems to be the biggest methodology of how people want to communicate. How many people open up their email from someplace, but if I get a text, that's the first thing I'm looking at. And if you're doing it the right way, where you're connecting to the portal, we see historical connection rates on outbound phone calls And we, on the texting that is driving a patient directly to the portal, we see 20+% of those connections happening on a text. That's probably 2 to 3 times better than phone call connection rates. And so you're technically increasing the number of people to engage with you. And more importantly, it's not just somebody picking up a phone, it's somebody actually going directly to the portal. And so I think texting, if that is not the methodology that you use or you don't use it today, I think that is the biggest thing for a prioritization for next step. There's some, the development of the app that is specific to you as a provider system. I think those are valuable, but I think the first big step is that text to portal, just because it drives so much value in there today. And then, we can talk about some of the fancy new things that'll be probably more prevalent in about 2.5 to 3 years, but I think that's, for me, the number one.
All right. Another question, when it comes to patient support on the website and phone apps, do you find that more patients prefer chat or calling?
Yeah, I think we're definitely just, the call volumes are still significantly there. Chat is functional and user friendly. And I know there's, some value in being able to do things like chatbot for simple answers. But if you talk about true live interaction, whether it's over the phone or chat, healthcare is still too complex, I think, for most claims, most issues. And so it's still the phone that drives 95% of those contact needs today.
All right. And another question, what is the average increase in collections you are seeing from moving to only self-service tools to a combination of self-service and full-service tools?
Yeah, I'll take that one. I'd say back to kind of the couple of case studies that we presented, right? We don't think there's really any ROI to just going self-service. In fact, maybe the opposite, even in some of the cases that we've seen where call volumes increase, they didn't decrease. That aside, I would say, again, that's not a thing to say don't use self-service. You just have to have the comprehensive solution. And we have seen very good results, at least in cash acceleration, if not even bad debt reduction, by using as many of the different tools today that we talked about as you can. Again, different people have different preferences for communication, and I'll use even within my own family. My mother will never respond to a text message from somebody she doesn't know, but she'll answer her cell phone every single time that you call her, right? Whereas I would just hit forward to voicemail if I don't recognize the number. And then you go to the other extreme, like my oldest daughter, who will probably respond to a text before she would do any other type of communication with you, right? So again, as you're dealing in hospitals with people from different age groups, different technology capabilities, and so forth, I think it's really important to use as many of the tools that we talked about today as possible.
Add self-service, continue adding self-service, but it's cultural shift. That takes a significant amount of time, and until you're able to drive the entire cultural shift away from using the phones, you have to have both to deliver. But I keep saying keep adding. As a healthcare service community, it's our jobs in total to try to continue to push that move from left to right. But you can't forsake the phone calls until you got a full cultural shift the other way. Trying to just force that cultural shift doesn't typically work all in one fell swoop.
Right. Well, again, thank you, Jeff and Greg, and thank you to Meduit, and thank you to everyone who participated today. Thanks, everyone, and I hope you have a great rest of your day.
Thanks for joining.
Thank you all.